Hi everyone. Well, thank you so much for coming today for our free webinar for young women and girls. And today we want to just do some work on what is a normal period. And this topic is something that comes up quite a lot in the research that we do with girls and young women on their access to healthcare. Next slide, Jennifer. So we know that everyone experiences periods differently, and it's really important to know what is normal to you and your body and when you might actually need to seek advice from a GP. And we know that can be really awkward for some people. So we're really pleased today to have a GP on the call that you can ask any questions to and anything that you're concerned about. So I'm Rebecca from the Young Women's Movement, and we are an organisation that works with young women and girls across Scotland on their leadership and their rights. And in our most recent report, young women reflected on the importance of learning about what a normal period looks like in school and how it can impact your mood, your energy levels, and even your academic performance. And there was one young woman who told me that if her mum wasn't in healthcare, she didn't know that having two periods a month wasn't normal. And it was only then that she actually sought help for a GP. So it's really important to know what is right for you and also for your body. We know that embarrassment and a lack of education remains a barrier for many young women and girls to better understand their periods, know what is normal, access information, and seek support if they are concerned. Next slide, Jennifer. So, this session today aims to approach periods in a positive and an informative way to challenge that stigma and be detailed in the key facts about periods and what is normal. So, today we are going to look at some topics like hormones and the menstrual cycle, common period symptoms, how to manage periods at school, and how to get help if you are concerned about your period. So, we hope that everyone leaves the session today feeling more informed about their body and the options that they have to manage their period and more empowered to talk confidently about their period and any concerns that they might have. So, just very quickly, this session is being hosted in collaboration with the Young Women's Movement and with the Health and Social Care Alliance Scotland. And Jennifer Stewart here on the call is representing Alliance. And Alliance is a third sector member organisation for health and social care. They work with organisations, communities, and lived experience to ensure their priorities are reflected in government policy. And since 2022, the Alliance has been funded by the government to deliver a women's health programme in support of the Scottish Women's Health Plan. And Jen's been doing some really amazing work around this. And a big part of this work involves ensuring that information about women and girls' health priorities is shared widely to challenge persistent stigma, myths, and misinformation. Next slide. So I'm going to hand over now to Dr. Rebecca Heller, who is a consultant in sexual and reproductive health at NHS Forth Valley. So thank you so much for being here today, Rebecca. I'll hand over to you to have to your side of the presentation. Thanks.
So hi everyone, my name's Rebecca. I'm a consultant in Forth Valley. I've done a fair bit of work with young women and young people having periods more in Edinburgh before I moved to Forth Valley. I'm going to cover some different things today, some different myths about periods, and some of the elements about when you might want to go and see your GP. I'm going to talk a bit about what's normal and why maybe doctors have a different idea about what's normal than young people with periods might, and we can talk a little bit about that. There's plenty of time at the end for questions, but I'm really happy for anyone to ask any if they have them as we go along, and that's totally fine. And so I believe that what you wanted to hear about was menstrual health generally, and this idea of a normal period. So I'm going to talk a little bit about that. And I'm going to start just with a very basic menstrual cycle. So you probably kind of dimly remember this from your school days, learning about your sort of basic biology. And we talk a lot about hormones when we talk about the menstrual cycle. So I'm going to talk you through the very basics of that. So you can see this is the follicular phase. You don't need to remember the names, but that's just the first half of your menstrual cycle when you're releasing, before you've released your egg. So your ovaries are filled with eggs, and in your first half of your cycle, your ovaries are getting ready to release an egg, which sometimes might be fertilized and most of the time isn't. And then your luteal phase, which is your second half, that's when your body is getting everything ready to make a nice home for that egg if it was to get fertilized. And along the bottom here, this is your womb. And you can see that the lining of the womb, which is the endometrium, which I'll talk about quite a bit today, that is building up and building up. And then when it's at its biggest, you then start your period. When we talk about a cycle as a doctor, we talk about a menstrual cycle as being day one of your period to day one of the next period. And so usually a doctor will want to know how many days you bleed for and what is the length of your cycle. And that's what they mean. When we ask about your period, we always want to know about day one of your period. That's what we're most interested in. So if a doctor says to you, when did your period start? They mean day one. And you've got four different hormones that you're basically dealing with. So the first one is something called FSH. It stands for follicle stimulating hormone, which again, you don't need to know, but each of your eggs is in something called a little follicle. And so as the follicle stimulating hormone, which is the blue one, the light blue here, you can see that that is promoting each follicle for the egg to grow. And the LH, that's called luteinizing hormone. You can see it has this big surge, and when the amount of it increases, that's when the little egg gets released there. Estrogen, which is one of the hormones that's in the contraceptive pill, the combined pill, which I know you've had some chat about before and which lots of you will be familiar with. Its job in terms of the cycle is to thicken the lining of the womb. And so you can see as it gets higher, the lining gets thicker and thicker. And then progesterone. So progesterone is in all the contraception that we have, apart from the copper coil. And its main job at this point is to support the fertilized egg. And then if the egg isn't fertilized, it drops. And as the levels fall there, that's when our periods start. So that's a kind of very basic guide to your menstrual cycle, which can sometimes be useful to know about when we're thinking about some of the different aspects of things. What is interesting is that it's 28 days here, and I'll talk about the length of the cycle, but the second half is pretty consistent. It's usually about 12 to 14 days. So for people that have a menstrual cycle that's usually 6 weeks or it's usually 7 weeks, it's always this first bit that's longer, but the time from when the egg is released to when you have your period is pretty consistently 12 to 14 days. Because you can always work out when you're ovulated by going backwards. I'm going to talk about some of the myths around periods because I think there's a lot of myths. And from the sounds of things, this is a myth that lots of people hold, not just people who have periods, but the myth is that periods are gross and disgusting. And there's some period blood there, so I hope no one thinks that too much. Not mine. I got it off the internet, although I wouldn't mind if it was mine. And they're just blood, really. There's some other bits and pieces in there, some secretions from your vagina, a little bit from your cervix, which is the end of your womb, and obviously the lining of your womb, that's endometrial tissue. But mostly they're blood, and we tend not to think it's gross and disgusting if we cut our finger. So hopefully we don't think it's too gross when that bleeding comes out of our vagina. I'm a gynecologist, so I happily throw around words like vagina constantly. The second myth, and I think this is useful for lots of people to know, is that a cycle should be 28 days. Because quite often young people come to my clinic and they say, oh, my period is always late. It's 4 days late every month. And that just means that that's your cycle. Because in reality, actually, anything between 3 and 7 weeks is totally fine. It's good if you can to get an idea of what's normal for you, just so that you know. You can use apps, and lots of people do. You certainly don't have to use an app. It's quite nice as a gynecologist if I ask someone when their period started and they just get out their phone and then they can tell me. But what's important is that you have an idea what's normal for you. And so if you know your cycle is normally about 5 weeks, then that's really useful for you to know because it helps give you information about when you would expect your period. But it's certainly not a problem. I think we've kind of got a bit fixated with this idea of 28 days, but that doesn't matter at all. If it's every 3 weeks, I mean, it's a bit of a pain, especially if you're bleeding heavily, but it's there's nothing wrong. That could just be your normal. Um, and so that again, if it's not 28 days, it doesn't matter. Um, what we want is it for it to be fairly consistent, but that's really just for convenience. Some people have a cycle that's 3 weeks, 1 month, and then it's 7 weeks, and then it's 4 weeks. Um, and as I'll go on to explain, that's not worrying, it's not a problem, unless it's a problem for you. Myth three is that a normal period is a light bleed. And I think it's tricky when we talk about amounts of bleeding, um, because for me, it's not really important what's normal, it's what you can manage. So an average bleed is about 35 mils, which a useful way of thinking it is it's about a shot glass. But really anything between 10 mils and 80 mils would be considered normal. And I'm going to talk about this idea of normal. But when we say normal, we mean that there's not a worrying cause for it usually. We wouldn't, as doctors, need to do lots of tests to see what's going on if it's within that amount. So 10 mils, that's 2 teaspoons, and 80 mils is 2 shot glasses. And anything up to that is pretty fine. So from a medical point of view, not worrying. If it's not the 10 mils, it doesn't matter. So there's quite a variety. Um, and I think when thinking about amounts, I mean, I have spoken to some people who bleed huge amounts and they don't mind and it's fine for them and they're happy to manage it. And I've spoken to some people who bleed what I would consider to be quite a light amount, and it's totally unacceptable to them. So it's really not about what's normal. It's really about, does the amount you're bleeding work for you, for your life? Does it fit in with things or does it get in the way of things? And that's much more important than, is it within the average bleed, which isn't very important to anyone really. Myth four, you should definitely have a period every month. And this comes up when we're talking about contraception because lots of the contraception that I use in my clinic means that people don't have a period every month. And some people can find that quite worrying and they worry, is that okay or is that not okay? Um, and when you think about it, the idea of all people who have periods having a period every month is relatively new because actually for a lot of history, we were pregnant lots and lots of the time, or we were breastfeeding lots and lots of the time. And actually, we potentially were getting married and starting families quite young. So this idea that, you have to have a period every month, apart from your 2 or 3 children that you have in your reproductive years, is quite a modern one. People used to have like 10 or 12 children. And I'm definitely not saying we should go back to those days, but we don't need to worry that our bodies will suffer in any way if we're not having a monthly period. The one sort of caveat to that is that if you're not on any contraception, we would want you to have a minimum of 4 periods a year. And I'm going to talk a little bit about PCOS and people that can have fewer periods or their periods can be further apart, and why we would want you to have 4 periods a year. But as long as you're having that many, it's safe for your body. And certainly if you're on contraception that would change or alter your periods, you don't need to have a period at all. It's only if you want to have one, which some people do. Um, Myth five, eating different foods can make your periods worse or later or heavier or lighter. So apparently I read online that some people think that lemons can delay your periods and that ice can make your periods worse or heavier or sorer. And you can just definitely put that to bed. There's nothing that you can eat or not eat or drink or not drink that will make any difference to your periods at all. Absolutely nothing. So you can eat whatever you want. Eat all the lemons you wish. Myth six, you can't get pregnant on your period. And when you think back to that menstrual cycle, um, you'll remember that you release your egg around day 14. But for some people, that first bit of the cycle can just be a week. And sperm, sadly, they are very strong little things and they can live inside you for 7 days. And you could ovulate after that. So it's definitely not a fail safe to have sex just on your period and not get pregnant because it happens and it could happen to you. So I'm gonna move on from myths to look at what is normal. And I think that the Young Women's Movement had asked some people what kind of thing they wanted me to ask and to answer. And this idea of normal came up quite a bit. So, types of irregular bleeding, what's normal and what's not, what level of pain is normal or something to worry about, what's normal or supposed to happen, and when it's appropriate to see a GP. So, I'm going to look a little bit at when you would see your GP and when that would be useful and when is an appropriate thing to see your GP about. So, I know that I suppose I'll say at the beginning that I know that it's not always easy to see your GP and sometimes it's quite tricky to get access. But if you have concerns about things or you're worried, your GP does want to see you. Um, it's not there are lots of problems around resources, but your GPs do still want to see you if you've got worried about things. And one thing that I would always say is bleeding in between your periods. So if you have a regular-ish cycle, whatever that looks like to you, and you have a bleed, and then some number of weeks later you have another bleed, but you have bleeding in between that, your GP would always want to see you for that. And that could be for a few different reasons, but that would definitely be something. So if you have bleeding that isn't your period and comes in between, and sometimes it's hard to tell if your cycle is really, really chaotic and you don't know, well, is this bleeding in between, or is this just my cycle and it's all over the shop, then that's okay as well. And those would be things that I definitely think it's worth seeing your GP about. I've said if the amount you're bleeding is too much for you, and like I said before, there is a really wide variety of what's acceptable to people, and that's fine. We are all different and we all have different lives. But if you feel it's too much and you're struggling, then even if it's the same amount as your friend and she's fine with it, then that is reasonable to go and see a doctor about. And, there are different things that we as doctors can do to help you bleed less. Now, those might be acceptable or not acceptable to you too, and that's fine. But you'll only know what your options are if you find someone who knows about them and asks. So that is another reason I would definitely see the GP for. And so it doesn't really matter what's normal or is this an okay amount to bleed. It just matters if you can manage that amount. And what I would say is that if your periods are stopping you doing things that you want to do, then it's definitely worth thinking about whether you do want to talk to someone about options that you maybe have to help you bleed less. Um, because we have lots and lots of options for you in the medical profession. And if you want to do things and you can't because of your period, then that's rubbish. And we would always say, come and see us, at least so you know what your options are. I'm a big advocate of people knowing what their options are. Ooh, that's not letting me do it. There we are. Um, I want to just talk briefly about endometriosis because this comes up a lot when I'm talking to young people about heavy periods and are their periods too heavy and are their periods normal. So I'll just briefly outline endometriosis. I do this a lot with my patients. So this is when the lining of the womb grows in other places. So you remember in the first diagram, well, you may or may not remember, your endometrium is the lining of the womb, which we would expect to be in the womb here. And endometriosis is when little, often quite teeny tiny amounts of endometrium grow other places in the body. And usually it's in the pelvis, close to where they're supposed to be. We don't know why it happens, but for some people it does happen. So you might have little bits of endometrium growing on your tubes or outside, elsewhere in the pelvis. You can have them growing on your bladder or your bowels. So people sometimes notice that when they've got their period, they have really bad diarrhea or they need to go for a wee lots more. You even read in the medical textbooks about it growing in people's ears and eyes. So when they have their period, they bleed from their ears. So uncommon, but it does happen, and that's what endometriosis is. And I think often people they feel very frustrated and they feel that they're not being listened to because they're being offered um, treatments for heavy periods and we don't know if they have endometriosis or not. But I always say to patients, there's no magic cupboard which says endometriosis on which you will have access to if you get that diagnosis, unfortunately. And so it is something that takes a long time to diagnose, and it's diagnosed only with an operation. So at the moment, the only way we can say for 100% sure that you have it is to look inside your pelvis with a camera and see those little bits that you can see on here, those little bits of endometrium that are in other places. Um, but you don't need that diagnosis to have access to all the things. Plus, you might have a camera look in and actually you don't have endometriosis. You just are someone who unfortunately is at the end of the spectrum where periods are much heavier and sorer, and that all the treatments would be the same. So if that's you and you're thinking, oh, I don't have that diagnosis and so I'm missing out, um, all the things that I'm going to talk about and that your doctor is going to talk about are the same, those different options for heavy bleeding. So a few other times you might want to think about seeing your GP. Those are the kind of main red flags, I would say. But you also might want to think about seeing your GP if you have mood symptoms that are a real struggle for you. Um, I think for those of us not on hormonal contraception, most of us will recognize feeling a little bit low, having the blues a little bit in the couple of days before our period. That's a pretty common experience, I think. But if you feel that that week is a real struggle and you just cannot lift yourself up, your energy levels are really flat, or it's even, especially if you're thinking kind of darker thoughts of self-harm, that kind of thing that wouldn't occur the rest of the week, then that could be a PMS type picture. And again, your GP has options to help with that. So that I think is something that is worth thinking about. It's sometimes worth keeping a wee diary. When do I feel really low? And if you notice that it's in the week before your period, particularly, then take that diary to the GP because that will be useful. The other thing is that if you're going lots of months in between periods, so like I said, there is variety in the length of the cycle. But if you are not having 4 periods a year and lots of months go by and you've not had a period, then that would be worth seeing your GP for. And that would be kind of one of the typical signs of PCOS. Sometimes when you first start your periods, you can have one period and then go a few months and then you have another one. And it kind of, the messages that your brain sends to your womb to have a period can take a bit of time to regulate. So in the first couple of years, we wouldn't worry so much about going lots of months in between because it just takes your body a little time to find its rhythm. But if you've been having periods for a while, or this pattern's been going on for a while and you're only having a few periods a year, that's definitely worth seeing your GP for. And the other thing is if you find periods a challenge because of your gender identity and you're not someone really who can tolerate a monthly bleed, GPs are used to that and you will not be the first person that's come to them with that. And all of the options that I'm going to talk about that reduce bleeding we give to our trans and non-binary patients as well. And that's just because sometimes a period is just too disrupting of your gender identity and you just want it gone. And we as doctors are totally used to that. You don't need to be embarrassed and we can present you with your options. So, what can a doctor do? Which is a good, reasonable question to ask. So one of the things that we can do is to talk to you a little bit about what's normal, and sometimes that can be useful. If you say this is my cycle and it's only every 6 weeks and I'm really worried about that, sometimes it's just useful to have a doctor say, no, that's fine, that's okay. If that's normal for you, that doesn't matter. But sometimes that can be frustrating if a doctor says that's normal because you feel like, well, I don't care if it's normal, it's annoying me. Um, and it might be worth, from my perspective as a doctor, why a doctor's obsessed with what's normal. And the reason for that is that when you come in and sit on that doctor's chair, what they're thinking is two things. They're hopefully thinking, what is this patient bringing to me and how can I help? But they're also thinking, is there something seriously wrong that I can't miss? And so when we say to you, it's normal or it's okay, you don't need to worry about that. What's happening in our brain as doctors is, oh, thank goodness, there isn't a cancer or a serious disease and this person is going to be okay. And probably that was never even in your head in the first place. So you don't even feel relieved that there isn't something serious going on because that maybe never crossed your mind. But for us, that's something that we're always thinking about. And so often when we say that's okay, it's normal, that's our issue because we're thinking, phew, there's not something uh, serious that will need managed. But obviously, if you're bleeding a lot and you're struggling, even if it's normal, that doesn't matter. We can offer you some options. Things that the doctors might do is talk about investigations. So, or ultrasounds and blood tests. Generally, an ultrasound doesn't give us a huge amount of information. I'm going to talk about that in a minute. And again, blood tests don't give us a huge amount of information, but sometimes they might help. And then the last thing that we can do is give you medicines, um, sometimes hormonal, but not always hormonal, um, to help reduce your bleeding. And we have lots of options for that. Most of them are contraception, and most of them do involve hormones. Um, but we can tell you about what those are. And then you can make a decision. Well, do I want hormones or do I not want hormones? Oh. So an ultrasound. So this is an ultrasound of a normal womb. As you can see, they're not the easiest to read. They're definitely not like a photograph, but this kind of curved bit is the uterus, is somebody's uterus, and that sort of lighter, whiter bit in the middle is someone's endometrium, and this is someone with a very thick endometrium, which we can see in people who are about to start their periods, and also in endometrial cancer, which tends to be in older people, sort of 45 and above. Um, so that's what we're looking for with an ultrasound. And an ultrasound doesn't usually tell us why people bleed heavily. It doesn't show endometriosis. It just shows us whether the womb is a normal shape or not. It can sometimes explain the cause of pain if we see a cyst on the ovary, but often it doesn't tell us why periods are painful either. So it's useful to check that there's nothing else going on, but it probably isn't going to give us a huge amount of information about why your periods are a struggle for you or why your periods are fine. So options. So if the trouble that you're having is that you're bleeding too much and you don't like how much you're bleeding, then you do have some options to reduce the amount that you're bleeding. The first one is something called tranexamic acid, and this is a medicine a little bit like ibuprofen. It kind of works in the same way. You only take it during your period, so you just take it for usually the heavy days, so kind of 3 days, 4 days, depending on your own bleeding. And what it does is reduces the heaviness of the bleeding. So you bleed less heavily while you're taking it. You obviously don't need it the rest of the month because you're not bleeding. And it doesn't have any hormones in for people for whom that's important. The other option to reduce your bleeding is hormonal contraception, and there are quite a few different options for that. I've put the JAG there. The JAG is really good for making bleeding stop altogether, and we do use the JAG quite often in our trans and non-binary patients because it's a pretty reliable route to no bleeding. There are some different options though, and most hormonal contraception is going to reduce the amount that you're bleeding. Different pills that different people can take. And as with anything, it's just about weighing up the risks versus the benefits. Most contraception doesn't really have risks apart from the combined pill, but it does have side effects and things that you might not like. And so then it's just about you and your doctor answering that question. Well, I don't like this bit, but this bit sounds okay. I don't like my heavy periods, but actually they're better than any of the other options, or I really don't like my heavy periods and I want to do something else for them. This is the Mirena coil or the hormonal IUS, and it is really, really effective at reducing bleeding. It also has the bonus of being good contraception, but we use it a lot in patients who aren't having sex and don't care about contraception, or they only have sex with women because it is so good at reducing the bleeding. I know there's a fair bit of myths and horror stories online about IUDs, but I would say if you are someone with heavy bleeding that's bothering you, do chat to a doctor because it can be life-changing. So those are some options to reduce the amount that you're bleeding, and your GP can talk you through all of those, any of those, and see if any of them are a good fit for you. PMS I talked about, so options to help with PMS. So if you're someone who is struggling with PMS and you find that in the week or weeks before your period, your mood is really dipping, then there are options for that. Okay, so antidepressants, and there's a couple of ways to take them. Our kind of best theory is that in those weeks or week before your period, the chemicals that make us feel better really dip in some people, and so we're essentially trying to replace them. You can take them just during the week that you need them, and that works really well for some people, that they just take a week of antidepressants when they would normally feel their mood much lower. Some people just prefer to take them all the time, and the evidence seems to be that they work about equally well. Hormonal contraception, which you can be quite nervous about if you are someone who suffers from PMS, and I understand that. But I suppose the way to think about it is that one particular hormone, the progesterone, is higher in the week before your period, and it's often that hormone that makes people are particularly sensitive to. So if we give you hormonal contraception, then your hormones are going to be in a much steadier state all through the month, instead of the peaks and troughs that are kind of normal for a menstrual cycle, but which some people just really struggle with. Usually we would say the combined pill or the patch in terms of PMS. And again, it's just about weighing up what's your preference, and what you feel better on, and what you prefer. The other thing is CBT, which is a kind of therapy particularly, and that has we have good studies to show that that is useful in PMS, probably for giving you strategies to help you manage when you feel overwhelmed, when you feel anxious, when you feel low. And some people use all three, or some people use a combination. PCOS, which is what I sort of briefly mentioned before when I was talking about the length of people's cycles. So in our ovaries, before we release an egg, we have lots of follicles. Most people, I think, have about 7 or 8. In PCOS, they have lots and lots and lots, like 20 or 30. We don't know exactly why it happens. But what can happen is that things get a bit chaotic. So your hormone levels can get a bit chaotic, your cycle can get a bit chaotic, and you're not necessarily having a period every month because you have all these little follicles releasing eggs, and the kind of smooth system of one egg being released doesn't always happen. So in terms of if you've had that diagnosis, or you think you might have that diagnosis, a lot of the times people just grow out of it. And people get a bit confused by that, because they said, I had a scan 5 years ago and they said I have PCOS, and then I had another scan and they said I don't have it. So what does that mean? But sometimes the body just sort of figures it out, and you have a normal amount of follicles in your ovaries, and you get back into a normal cycle. Sometimes pregnancies can help with that. Not always. Sometimes it just gets better. Again, I do work in sexual health, so I do have a theme here, hormonal contraception. And the reason for that is because if you are having a bit of a chaotic menstrual cycle and you're not having a period on a sort of semi-regular basis, then the lining of your womb can build up and build up and build up. And if you go lots of months without a period, then that can, particularly in women who are older and in their 30s and even their 40s, can lead to changes in the lining of the womb, which can lead to cancer, basically. And so that's why we want to make sure you have at least 4 periods a year, or that we keep the lining of the womb nice and thin and stop it building up. And what hormonal contraception does is it keeps the lining of your womb thin. They all do that, basically. The hormonal IUS or coil is really good because it gives the hormone directly to the lining of your womb, but really any of them will do that. And so if you're someone whose periods are really, really infrequent, we would probably recommend that you were on hormonal contraception. Or the other thing that we can do is give you hormones, usually 4 times a year, to basically induce a bleed, to make you have a bleed. And that's fine for your body as well. So if you would prefer not to be on hormones all the time, then you can just have a sort of short, sharp course of hormones 4 times a year, and then you can have a bleed, and that's fine too.
For more information, see the links in the description box below.